Good morning. I'm very happy to be here today to share and exchange thoughts about the role that nurses play, the dramatic role that nurses can play in accomplishing a revolutionized healthcare delivery system so that all our citizens can benefit from nationally delivered healthcare. I hope you can and will bring to the public's attention the sweeping contributions nursing can make to improved national, cost-effective health care for all of our citizens, regardless of their diversities within our cultures. As Grace Marie mentioned, the state of our healthcare system continues to be a topic of intense national debate and discussion without many productive resolutions. Much attention, again, as Grace Marie pointed out, has been focused on the safety and quality of healthcare delivered in this country. Equal focus must be placed on the fact that access for all who need health care is as important as assuring that the care they receive is quality and safe. Currently, hospitals are preparing for the Center for Medicare and Medicaid Services change to a pay-for-prevention system that will deny payment for conditions that patients acquire while they are in the hospital, marking a new era focusing on prevention, a new era in payment for hospital services. Nursing workforce issues have also received a great deal of attention, including the aging of our ranks and the shortage of RNs that is predicted to worsen, presenting a significant crisis for the nation. According to the American Association of Colleges of Nursing, this year, schools of nursing turned away 40,285 qualified applicants to baccalaureate and graduate programs, primarily due to insufficient numbers of faculty. The nursing profession and other allied groups are working with Congress and other funding sources to deal with the acute and growing need to move appropriately educated nurses into faculty positions in order to keep the nursing pipeline open and flowing. While it is indeed critical to make certain that there are funds to support nursing faculty, nursing students, nursing education programs, a revolution won't be achieved just by assuring a sufficient nursing workforce. We must create a national health norm that emphasizes individual personal responsibility for wellness, intervention to prevent health problems, early identification of disease symptoms and illnesses, and when disease or illness occurs, treatment of the individual in the context of his or her culture, life circumstances, family resources, all the things that are not in focus when health care is reduced, as it certainly is today, to getting treated when you're sick, or you've experienced trauma, or you have pain or a debilitating condition. Nursing can play a key role in our healthcare system. Currently, the services that nurses provide are incorporated into the cost of using the facility, that is, the hospital daily rate, or the agency fee. The nurse, the nursing care, and the impact of nursing care on the patient's outcome remain invisible in the usual and customary payment system. Along with a new national health norm, we need to create a new paradigm for professional caregiver roles. The clinical nurse specialist is one of 4 roles that are commonly known as advanced practice registered nurses, or APRNs. The other 3 roles are nurse practitioner, certified registered nurse anesthetist, and certified nurse midwife. Each of these 4 roles has a unique nursing scope of practice. All are required to have advanced educational degrees in nursing, and including an educational core that is comprised in part of advanced health assessment, pharmacology, and pathophysiology. Unnecessary barriers currently prevent APRNs from offering the full scope of services that they are educated and competent to provide. And I have just one example, although I could give you very, very many. In Indiana, a multi-hospital system saved millions of dollars by reducing to zero their incidence of ventilator-acquired pneumonia, or VAP. VAP is a major complication of ventilator use, an extraordinary expense to the hospital in terms of extended days of intensive care, and a significant cause of patient morbidity and mortality. Their hospital-wide VAP reduction program was developed, initiated, and implemented by their critical care clinical nurse specialist. Because of her, that hospital system saved millions of dollars. In some states this can't happen, though, because collaborative agreements are required for a clinical nurse specialist in her advanced nursing role to be legally authorized to do what she was educated to do. Such an agreement authorizes her to practice that for which she is educated and competent, but only if she's authorized by someone who's not similarly educated. The country's nursing workforce includes RNs, LPNs, and nursing assistants, all of whom have a role in providing direct care, and some RNs also manage and lead the healthcare delivery team. Our current system of care delivery relies on nursing personnel as the wage-earning workforce present 24 hours a day, 7 days a week. Clinical nurse specialists and other nurses who are expert at educating patients and families about health risks and their prevention should be at the core of a new healthcare delivery system. All households should have access to these educational services, which could be delivered and should be delivered in the context of the family's culture, community, and resources. To build a workforce that is adequate to this task, job retraining and other employment initiatives should focus on bringing individuals into healthcare roles that are based on their own cultures and communities. Think of the additional benefits of moving unemployed or underemployed but capable individuals into entry-level healthcare worker roles. Teams of advanced practice nurses and other nursing personnel have the potential for meeting a wide range of healthcare needs beyond prevention and education. Basic primary care, support for self-care among the chronically, mentally, and physically ill, support through grief and loss, health education related to illnesses or parenting, and home follow-up of families with preterm babies are some examples. And referral for community services, including referral for medical evaluation and treatment, are also within the purview of nursing. I have several points to make for you to think about that could be a start on the road to a healthcare revolution. Place greater national priority on wellness and disease prevention and early treatment of physical and mental illness once it occurs. Advanced practice nurses and other nurses represent an underutilized professional resource that must be tapped to full capacity in order to revolutionize healthcare. Dispel the unfounded notion that care by advanced practice nurses is less than quality care. Eliminate requirements for oversight of one profession by another. Through online education and other technology, bring education to consumers and individuals interested in entering the healthcare workforce. Use technology to bring consumers and caregivers into contact with one another. Provide mobile units with modern technology for reaching remote areas, connecting technologically with healthcare centers. And open healthcare payment systems to all qualified providers. Thank you for your attention and this opportunity to share these ideas, and I look forward to your questions when our panel presentation is completed.
Thanks, Ruth.